Hi, Dr. Saxena here, and this event I just want to talk about what are the areas, and we always talk about good bacteria, bad bacteria. We used to emphasize a lot on particularly the oral hygiene. Let me tell you what is this oral hygiene and how things can always start from here and go to that different ramifications. What I'm trying to talk about is when we talk about the normal oral hygiene, the bacterial content load on the teeth is 10 to 20 milligrams of indigenous flora, which is 1 to 2 into 10 to the power of 9 colony forming units. So this results in something like asymptomatic bacteremia, the bacteria from which are there in the around the gums and all that around the teeth, which are a normal. We were talking about normal oral hygiene. They tend to get into bacteremia. Bacteremia is a spread into the blood, and this spread into the blood is 0 to 5 CFU, colony forming units per ml in blood, and it doesn't have any LPS. LPS is lipopolysaccharides, and no HSPs. HSPs are sheet shock. So this is the asymptomatic bacteria which causes some stimulation of the immune system, which results in no immune reaction, and sometimes it's beneficial, and most of the time there's a beneficial immune reaction, humoral immune reaction and antibodies to normal flora, and you start getting productive antibodies. So what happens in a person who has got a poor oral hygiene? Poor oral hygiene is one thing you need to understand. The bacterial load on the teeth is 20 to 200 milligrams. When you compare with the normal, it is 10 to 20, where in poor oral hygiene it is 20 to 200 milligrams, almost 10 times that particular stuff. And indigenous flora may consist of staphylococcus, mutants, we have got pseudomonas, gingivalis, and others. So this forms up to 2 into 2 to 20, 10 into 10 to the power of 9. When you compare with the oral hygiene, normal oral hygiene is 1 to 2 into the 10 to the power of 9 CFUs. So with this particular load in the gums and all that, because gums are connected to the blood capillaries, and through that you get into something like bacteremia, you get into something like asymptomatic bacteremia. Bacteria gets into the blood, and these numbers are 5 to 50 colony forming units per ml of blood, and there is a low concentration of LPS as well as HSPs. Whereas in the normal this one, there was no LPS or HSPs were there, and it was 0 to 1 colony forming units are there. This causes a harmful immune reaction. This asymptomatic bacteremia results in harmful immune reaction, increase white blood cells. You get into something like increased CRP and fibrinogen. These are the tests we always use. What is the kind of inflammation the person is going through? Now we have got a highly sensitive C-reactive protein test. We try to look into that. Increased LSPs and HSPs, LPS and HSPs, which are usually reactive T cells. And apart from that, you have got increased tumor necrosis factor, TNF beta, TNF alpha, and IFNs also. So these antibodies are formed to the lipopolysaccharides as well as HSPs, which are pathogenic antibodies, and with this you start getting autoimmune reactions. Autoimmune reactions can occur to the heart as well as to the joints, as to some other organs. So our kind of work, what we started looking into thing is this oral health which is responsible for your heart problems. Yes, there were studies which were done which showed this oral bacteria, which can be something like streptococcus or porphyria, it's Pseudomonas gingivalis, and there are some other kind of stuffs which can enter into the stomach. Stomach has got high levels of Helicobacter pylori, and again a good bacteria, but if it is, you need to always keep a check on this particular thing, and this can migrate into the bloodstream and get into something like phagocytosis. The macrophages burrow into the wall of the blood vessels to gobble up the irritants and infect the neighboring arterial cells. See, whenever these bacteria are get into the bloodstream, the macrophages burrow into the walls of the blood vessels and gobble up the irritants and infect the resultant with this irritants and the resultant this one phagocytosis. The infected arterial cells attract more macrophages, gorge themselves on diseased tissue and die. So the result is the large plaque that narrows the blood vessel. When pieces of plaque break down loose, they can start blood clots and cause heart attacks. This is the reason we started talking about your epigingivitis or gingivitis, and your oral health is really responsible for your heart problems. This concept which we are looking this infectious diseases as a possible causative factor of cardiovascular disease. This work was done by Aristo Vojdani and the likes of they have tremendously shown the kind of stuff. So we believe this can be a instigators to your atherosclerotic formation, and that is one thing which has to be taken not lightly, in the sense I always believe that you need to always look at what are the possibilities, because whatever we are working on this particular segment, and we don't see any major things with the patient, because most of them, they are non-smokers, they don't they're not alcoholics, and they are very careful in the diet and all that. So what are the things which are really bothering us? This might be the reasons which just by neglecting your oral health, you can land into that kind of big heart attacks. I'm sure this should be properly understood by each and every person who is trying to see that he is into optimally fit situation. He's trying to take every measures, he's trying to cut down your cholesterol, he's walking, he's exercising, but not just looking at the oral health may cost you a big thing. Thank you.